Good evening, everybody. We want to welcome you to the new series at the CS Mod Center that is talking with experts in women health and reproduction. My name is Gilmore. I am the director of the CS Mod Center for Human Development. And we will be having the serial lectures once a month. And our plan is to invite local and as well national experts in different aspects of women's health. This is an interactive meeting. We want to have your opinion and to share the knowledge that our experts have with you. But more important, we want to answer the questions that you may have. So please feel free to send your questions either by the chat or we will open for questions at the middle of the program and you can unmute yourself, or at the end of the program also you can unmute yourself and ask the questions that you have. So it's a great pleasure for me to initiate this series lectures with, again, a leader in a field that is of high relevance in women's health, that is cervical cancer. And my guest of tonight is Dr. Radhika Gogoi. Thank you so much for joining us this evening.
Thank you, Dr. Moore, for the chance to be here today. It really is my pleasure to be the inaugural speaker for the CS Mott Center Seminar Series on a topic that is really near and dear to my heart. So thank you again.
Thank you, Radhika. So why don't we start? Tell us a little about yourself.
So my name is Radhika Gogoi. I am a gynecologic oncologist at Karmanos Cancer Institute and Wayne State. I am new to Detroit. I moved here about a year and a half ago, a little bit before COVID. But prior to that time, I've been practicing gynecologic oncology for the last 12 years in central Pennsylvania. So it's been great to move here and the opportunities and the challenges that come with academic medicine.
So, Radhika, let me ask you a personal question now. Why gynecologic oncology, which we know is one of the most difficult areas in gynecology?
So, I think most gynecologic oncologists have a passion for taking care of women. That is really why we choose the specialty that we choose. I think the relationship that a cancer doctor and their patients have is a very unique one. It lasts not only from the diagnosis, but sort of for their lifetime. And it's not only with the patient, but with their families as well. And then the other part of why I chose is the chance to do prevention. So I think we all would very much like to be out of not having to need us anymore as a cancer specialist. But since that's not the case, we and I are firm advocates for prevention, whether that is screening, vaccination,
which is what we are going to talk to this evening. Yes. So this evening is about the cervix. Why the cervix?
Right. So I have a little slide thinking that maybe it would be easier kind of to show in a pictorial fashion kind of why the cervix is important. And so what you'll see on the slide is really a depiction of
there you go.
Of the uterus and the cervix. So the cervix is really the very lower part of the uterus, so the end of the uterus. And you can think about the cervix as sort of a gateway, and it's a gateway to the uterus. So it has a number of very unique functions, and specifically the cervix, of course, prevents infections from going up into the uterus. It is important in terms of the health of the vagina, and in terms of pregnancy, it's really important in that early cervical dilatation can increase a woman's risk of having a premature delivery.
So it really is a gate that is separating the internal reproductive organs with the rest of the world.
Very much so, yes.
And we know that there is a lot of bacteria, microorganisms in the lower reproductive tract. So the cervix is extremely important in controlling what it passes through.
Yes, absolutely. prevents infections from developing within the uterus. And then, of course, as a gynecologic oncologist, it's important to me because oftentimes it is sort of the host, you can think of it as, for a number of infections that occur in women.
So it is exposed to a lot of things, so that means also is in high risk. And that goes to my next question. What are the major concerns or complications in women's health related to the cervix?
So there are a number. We talked a little bit about pregnancy and the complications. So the cervix during pregnancy is important because it maintains the uterus and the pregnancy within the uterus. So early dilation of the cervix or softening of that cervix will lead to potentially premature delivery. The cervix can be the site or the host for a number of infections, including bacterial infections, viral infections, and then can be the site of obviously more significant changes in the cells of the cervix, including precancerous changes and then cervical cancer.
Cervical cancer, which is one of the topics that we want to talk this evening. What are the main causes of cervical cancer?
So the majority of cervical cancer is caused by an infection with the human papillomavirus. So you've all probably heard of HPV, then that is the human papillomavirus. It is a DNA virus that is, in the majority of cases, is a sexually transmitted infection. Now, the human papillomavirus is very common. There are some studies that show that about 9 out of 10 women, or 7 out of 10, depending on the study, of reproductive age will have this infection at some point in their life. Importantly, most of the infections with HPV really don't cause any changes. There are only very specific types of HPV that really lead to more significant changes in the cervix.
So that is a very important aspect that you mentioned. So if a patient or some young lady comes and say, oh, I got positive for HPV, should I be concerned that I'm going to have cancer? Or you are indicating that that may not be the case, that there is not all the viruses are created equal.
Yeah, that's a good, absolutely. So the majority of HPV viruses, as you said, really don't cause any significant complications. There are viruses, HPV types that are either low risk or high risk, for example. Low risk sometimes can cause no symptoms. They can cause condyloma, which is...
Condyloma, wait. Now you lost me. What did you say?
So condyloma.
Condyloma. What is condyloma?
Right. So condyloma are small bumps that are associated with an HPV viral infection. The generic term would be warts, for example. There can be in any area they can affect both men and women. So HPV, important to recognize, is that HPV infection isn't limited to women alone.
And I think we have a question. We have a question about that. Why don't we bring out our members? Somebody in the I saw that there is a question about men and HPV. Alisa, there is one of the there is a question. All these complications in HPV can affect men.
Yes, very important. That yes, HPV infection is not limited to women alone. Interestingly, in women, we can screen for HPV infections using a pap smear. In men, there is no screening test to see whether they carry HPV. So men who are infected with HPV or have a higher risk strain can have the same condyloma or genital warts. Other cancers that are associated with HPV infection in men are slightly different than those in women. So, for example, men that are infected with the high-risk strains of HPV or HPV cancerous types can be affected with penile cancers, anal cancers, and now what's important to recognize is that oropharyngeal cancers or cancers of the head and neck or the throat are also associated with HPV.
So if I get in the message that you're telling us is that the cause of cervical cancer is not really a disease of the woman, this is a partner disease. and we should be looking both at the man and the woman.
Yes.
Now, in the man is not only the sexual way the transmission of HPV. I mean, a man can get HPV by different exposure, or is only a sexual transmitted?
So the majority of HPV infections are sexually transmitted, in that there is some contact with hands or genitals, but there are other ways. So for example, babies can be infected with HPV transplacentally or through the vagina at the time of delivery. It's less common. So really the most common way that HPV is transmitted is really through sexual contact.
Or sometimes going to common pools, towels also could be a source of HPV in people.
Yes, less common, but certainly there are cases of that, yes.
Fantastic.
Dr. Moore, I think we have another question.
We have some questions from the audience. Can men transmit HPV to women who do not have it?
Yes, there's so the transmission of HPV can go in either direction, meaning that it can certainly go from an infected man to a woman, as well as from the woman to the man. So again, to the point that HPV is really not a disease that affects only, or a virus that affects only women, but it is really equally affects both sexes.
It's an excellent question, but again, I like what you are explaining, because really in many cases we look at cervical cancer or HPV like a woman's disease, and where we are understanding for you it's not the case. There is a case in both men and women. So the partner, the couple should be approached when there is this type of problems.
Absolutely. And to that point is that really that, while cervical cancer rates have stabilized across the United States and maybe even going down, the rates of head and neck or HPV infecting the head and neck and the throat, those rates are going up. And unfortunately, those rates are mostly in men. And so we really have to be very cognizant as a community about treating both sexes and educating both men and women, boys and girls, about the risks of HPV.
That I think is a very important message that we have to take in consideration. We have another question. Can men get cancer through HPV? And I think more or less you mentioned that, but maybe clarify.
Sure. So yes, absolutely. Men can get cancer through high risk.
Not cervical cancer, because as long as I know, men don't have cervix.
Yes.
Yeah? But you were surprised that some people could think.
Yes. So no, not cervical
They don't have
cancer.
cervix.
But certainly penile cancers, anal cancers, and again, now most commonly head and neck cancers. So
And they will appear, the lesions will be similar like you will see in the woman? The
it
type
will
of
be,
lesions?
yes. The presenting symptoms will be similar. They will be bumps, lesions, things that, bleeding that is not normal, growing, a lesion that grows. Any of those things should really prompt someone to get evaluated by their doctors.
Very good. So I know we have a lot of questions about that, but so we will go to those subjects. Let's focus a little about the cervical cancer to understand a little more what is cervical cancer. And before you mention, let's clarify what type of HPV will induce cervical cancer.
So there are obviously a large number of strains of HPV. The high-risk strains, specifically when you'll hear us talk about HPV 16 or HPV 18. These are strains of HPV, and those are the strains that are most commonly associated with cervical cancer.
And I think this aspect is important because I know there is a lot of interest in understanding virus today because we are in the COVID-19. And you know that you talk about SARS-CoV-2 and that there is this H1 variant and so on. It's the same in papilloma. So it's the same family, but there are variants. And what I mean with variants is they have modifications in the genome. And those modifications is what it makes that virus to be carcinogenic in a way. Yeah, can we say that?
Yes, absolutely. HPV is a well-known, well-established carcinogen.
So not all the viruses will induce cancer, but when they acquire some potentials, those viruses with those characteristics lead to the cancer.
So that's also important to your point, Dora, is that the it's important to know which of those strains it is because the vaccine that is used in HPV or the HPV vaccine is protective against those high risk types of viruses. So the vaccine doesn't protect against all HPV. So the current vaccine is a 9-valent vaccine, meaning that it protects against 9 subtypes of HPV, the most important of which are 16 and 18, which we were talking about. But it also does protect against some of the low-risk strains of HPV, which may cause genital warts or condyloma.
That is painful and so on. I think we have a lot of questions of HPV and vaccine. So before we start answering all those questions, and thank you for your participation, let's introduce a little about cervical cancer, especially what is the symptoms and its development.
So cervical cancer, actually, thankfully, is a fairly slow-growing disease. The studies that we have suggest that it takes anywhere between 6 to 10 years for a normal cell to become a cancerous cervical cell. So that gives us a lot of opportunity for screening, for prevention, and for treatment, really, if we have that long a period of time to intervene. The symptoms of cervical cancer are fairly, Catherine, you mind me? They're fairly, people will notice these. So, for example, bleeding after intercourse is a big presenting symptom. Abnormal uterine bleeding when you shouldn't be having them, so in between your periods. Profuse or a very smelly, malodorous, we call it vaginal discharge. Those are all symptoms that patients may notice.
And when the patient sees those symptoms, what they should do?
Right. So if you have these symptoms, you certainly should seek medical care. Some patients get their gynecologic care with their family physician or primary care doctor. Some get their gynecologic care with a gynecologist. So any of those specialties would be where you should go next. Most importantly, it is to seek care, to not delay, not to wait.
Don't wait.
That is absolutely the message.
So if the symptoms are there, the patient will come with a gynecologist. What is the gynecologist going to do?
So generally speaking, the gynecologist is going to do a pelvic exam. So you do a speculum exam. Depending on the significance or the severity of the symptom and what they see in the exam, they may do a pap smear.
Oh, the magical word, the pap smear. When a woman should have this pap smear?
So the current recommendations, and these change, but the recommendations today are that women after the age of 21 should get a pap smear.
When? Every month, every 3 months? What is your recommendation?
Right. So the recommendations really vary by age. So between the ages of 21 and 30, the guidelines specify, depending on the type of pap that you do, whether it's just a pap smear or whether it's a pap smear along with HPV testing, anywhere between 3 and 5 years.
Okay.
But the most important thing, again, is that screening should start at the age of 21, regardless of whether a person is sexually active or not. Obviously, if you're younger but you're having symptoms, that shouldn't stop you from going to see a gynecologist. You should absolutely seek medical care for symptoms such as the ones that we were describing.
And there was a question related to that, whether by looking at HPV, the pap smear is necessary or not.
Right. So at this point, depending on the type of HPV that's identified on a pap smear, the recommendation is to still do a pap smear regardless of whether you're HPV positive or not, because the algorithm for what you do with that result changes depending on what the pap smear shows. At some point, I expect that HPV testing will make pap smears obsolete, but we're not quite there yet.
Fantastic. Let's move a little on into terms of the cancer, understanding the cancer, and then we will talk about the prevention and the vaccine. So what are the different stages of cervical cancer?
So cervical cancer, much like most cancers, are kind of divided into 4 stages. There's an early stage, and an early stage, what I call sort of an intermediate stage, which is called locally advanced, and then a late stage. So the early stage is really cancer that is just limited to the cervix, and a locally advanced, maybe cervical cancer that is a little bit more than just the cervix alone, may involve the side wall, what we call the parametria, and then an advanced cervical cancer is cervical cancer that has gone outside of the pelvis.
And we know that the best prognosis is if it still is local.
Absolutely.
Anything that move out is a different story.
Absolutely.
So identifying the disease early is critical.
Yep.
Treatments. What are the treatments for cervical cancer?
So it really depends on where on the stage of the cervical cancer. So an early stage cervical cancer may be treatable with surgery alone. Anything more than cervical cancer that is just confined to the cervix really needs a combination of both chemotherapy and radiation. Advanced cervical cancer, so cervical cancer that has gotten outside of the cervix, probably will be treated with just chemotherapy.
And what is the prognosis of cervical cancer diagnosed still in the early stage, in the local stage?
So actually, it's very good. So the majority of early stage cervical cancers can be cured with surgery. Again, the goal is to catch the diagnosis at it as early a stage as possible, so that one, it offers the best outcome and it offers the best options for treatment.
So if I understand what you're telling me now, the second message is don't wait. If there is any sign, go and find what is the problem. Because if it's early detected, the prognosis is much, much better than in late disease.
Absolutely. What we tell people is to be your own advocate.
And as we go in medicine, prevention is the best thing. Now, that brings us to the subject that we started, and now that I think is the interest of everybody, the vaccine, again. And I have a question from one of the people in the audience. Why does HPV vaccine only say to work when given at age 11, 26, and not as effective after age 26?
Yeah, so that's interesting. The earlier, actually probably prior to a year or two ago, the recommendations were for the vaccine to be given between the ages of 9 and 26 in both boys and girls, men and women. Since that time, there is some data and some recommendations that suggest that HPV vaccination should be given to any person up to the age of 45. And the idea really is that vaccines are more effective prior to actually having an initiation of activity, of sexual activity, or being infected with HPV. So you're less likely to be infected by HPV at an earlier age than at a later age. And thus the efficacy of the vaccine is better if it's given early as opposed to if it's given later.
And I think it's also because of the maturation that the reproductive tract is having. A young lady is still the walls of the vagina and the cervix are thin, more, let's say, prone to be wounded, if you want. As a woman mature, it starts becoming stronger, we can call it. Is that correct?
Yeah.
So that is the reason of the sensitivity we call.
Yes. So it's important that the earlier you get your children vaccinated, the better.
So now, can the HPV vaccine cure cervical cancer?
No. HPV vaccine is not a therapeutic vaccine at this point. It is prevention. So the idea is that the goal of the HPV vaccine is really to prevent HPV infections, not to treat HPV infections after they have already developed. At least not cervical cancer.
Yeah. We have another question here. What is the vaccine and what is made of?
Yes, that's a great question. So I have a little graphic that just shows kind of what the HPV virus looks like. Because I think that it's important in terms of understanding at least what the vaccine is made of. So this is just a pictograph of really what the HPV virus looks like. And so what you can see is the very surface of the virus contains what we call capsid proteins. And so they're in a rosebud configuration, and they're kind of all over the surface of the virus.
Can you point to so the people will look at it, because you're telling me capsule, it sounds to me like Chinese. Those are,
yeah.
okay.
So
perfect.
those are the capsid proteins. Now the
like the
vaccine,
flowers of the virus
yes,
that are pumping
that's
up.
yes,
Which
absolutely.
also in COVID-19 and SARS-CoV-2, they have also these flowers that are called the clown.
Yes.
That is the reason we call it corona.
Right, absolutely. So for the HPV virus and the HPV vaccine, what you're getting is really just those proteins alone. So just those capsid proteins without any viral DNA. So it's important to understand that the vaccine is made of only of those proteins, doesn't contain any HPV DNA, and then is given to produce an immune response to prevent further HPV infections.
And that has been a misconception of many people, thinking that when you get the vaccine, you're getting the whole virus.
No, not the case at all. And again, I mean, the vaccine has been around now for at least 15 years. So it has a very long safety record. We have a lot of data on it, both safety data and now efficacy data as well, meaning how well does it do what it's supposed to do. And the data suggests that really it decreases the risk of developing HPV related infections like just cervical precancer and cervical cancer.
Here is an interesting question and a tough question. So of one of our audience. If you are vaccinated against HPV, can you still become a carrier? That's the first question. Maybe you want to answer that, and before I continue reading the other one.
So yes, so just because you are vaccinated against HPV, you can still be a carrier. You can still have abnormal pap smears. You can still develop precancerous changes as well as cancer. The goal is to decrease that risk. So because you get vaccinated doesn't mean that women can not go to a gynecologist or get their screening pap smears. The recommendation is still that those screenings continue regardless of whether you're vaccinated or not.
And I think this is a very important aspect, because it's also a confusion that we have sometimes. We are now dealing with the vaccine against COVID-19. And I apologize that I bring this, but I think we can learn a lot from the two things. A vaccine is not a capsule that then isolate us from the rest of the viruses and from the rest of the things. Yeah? We still are in the middle of this soup of viruses. It's only that the vaccine is making our immune system stronger, so we don't get very sick.
Yes.
Yeah?
Yes, absolutely. Decreases the risk of developing cancer or precancer.
But it doesn't mean that once I have the vaccine, I can do whatever I want in my sex life.
No, unfortunately.
But it has another question still in that if a man has been vaccinated and then has sex with an HPV positive patient, can he then pass on HPV to another partner? That's a challenging question.
It is, but I think the idea is the same, which is that even if you are vaccinated, you potentially can still carry the HPV virus. And so if you carry the HPV virus, you potentially can then also transmit the HPV virus. So it doesn't change the risk. It doesn't, yes, essentially the answer is yes, you can still become a carrier and still potentially transmit that to another partner.
The vaccine is only protecting the individual that will not become very sick, or will not become sick potentially. I have a question here. Can you have HPV and abnormal pups if you have a hysterectomy?
Yeah, so HPV can affect both the cervix and the vagina. And so you can still have abnormal paps even after you've had a hysterectomy, especially if the hysterectomy was
Could you tell us a little bit, what is hysterectomy?
So a hysterectomy, a total hysterectomy is something that removes both the uterus and the cervix. I'm gonna caveat a little bit in that you can do something called you'll hear the term partial hysterectomy.
Yeah.
Or in a more medical term, it's called a supracervical hysterectomy, where the uterus is removed, but the cervix is still left behind.
You keep the door. You remove the door,
Right,
you remove the rooms, and you keep the gate.
That is the analogy.
Yeah.
And so if you still have the cervix in, the recommendation is to still have the same screening that you would have had if you'd never had the hysterectomy. Now, if the cervix is removed and it was for fibroids, nothing to do with cervix or abnormal pap smears, then you really don't need any more pap smears. That is the recommendation. But if the hysterectomy was done for the reasons of abnormal paps, then the standard surveillance is still indicated.
And what would be the reason, again, I'm thinking of keeping the cervix? What is the advantage of keeping the cervix if the patient doesn't have cervical cancer, of course?
So a lot of times it is patient preference or physician preference. Removing the cervix can sometimes, it can increase the length of time of the surgery. Patients that have had previous abdominal surgeries, it can be a little bit more difficult to get the cervix out. There are patients that feel that taking out the cervix limits their sexual activity, although the data doesn't suggest
that. Was my question. Those concerns are real or not?
The data doesn't suggest that there is any difference in sexual activity if you remove the cervix or keep the cervix in.
And the recuperation of the patient is much better by removing the cervix and the uterus, or just the uterus, in terms of how the patient then will come out of the surgery. Is there any difference?
There is no difference.
There is no difference. So at the end, it's a decision between the physician and evaluating the situation and the patient.
Absolutely. Just like everything else, it should be really a risk-benefit discussion made between the physician and the patient.
We have another question here about the vaccine. I hope you are an expert in immunology. And
if not, I'm sure that you can help me with this.
The question we have here is there a significant difference in the caspid composition between different strains of HPV? That's a very good question.
So yes, my understanding is the different HPV strains have different capsid components, or the makeup of the capsid is different. And so yes, the capsid composition is also different between the different HPV strains.
And that's the reason it doesn't protect against all the HPVs.
That's correct.
The vaccine is mainly for the protection of the strains, the 16 and 19, who are the most dangerous for cervical cancer.
That's right.
And for the cancers in the man.
Yeah, absolutely. And in the United States, there really is only one vaccine available. You'll hear Gardasil. It's a 9-valent vaccine, again, which means that it protects against 9 subtypes of HPV. That's the only vaccine that's available in the United States.
That's the one in the United States. Is that different from the one in Europe?
So in Europe, I believe there are still there's a Gardasil 4-valent, which only contains 4. And in the past, there was a vaccine called Severix, which only was a 2-valent vaccine, only again 16 and 18.
And we don't expect from the audience to remember all those names that you say. But if you're interested to know more details about the different type of vaccines, please write us, and we can repeat again the different type of vaccines, the ones who exist in the United States as well as in Europe. An interesting question, going back to cancer again. But why don't we make a break of a couple of minutes? First of all, again, to thank everybody for joining us this evening, to remind you that this is the first of our Talking to the Expert program here at the Mott Center. And we would like, maybe if there is a direct question, if somebody would like to use the speaker, and would like that we unmute if you have any question. If there is anybody who have a question, please unmute yourself, and you can bring the discussion or the conversation, or if you have any suggestion. Is it okay with you?
Of course.
I know that it's sometimes a challenge that. Alisa, you will let me know if somebody either raise their hands or unmute, and then we can allow the person to ask the question.
So I had it's Steve Krawitz here. I have a question, if I may, and that is, given the current state of the Pap smear, I would assume there's going to be an evolution in terms of the technology used for that, and specifically, most specifically, I would expect things like next generation sequencing or other modern approaches to be adopted. Are you aware of any of these types of assays being developed, which would permit even earlier detection and possible modalities of treatment?
That's a great question. So, I think the idea of the Pap smear is sort of a population-based screening study. So I think that as such, you sort of have to do the low-tech but high-volume approach, if that makes sense, to screening. And so at this point, a lot of our Pap smears are automated, which allows us to do a lot more. The identification of specific HPV subtypes have really changed and revolutionized the algorithm that we use for treatment, in that we can really predict. So infection with HPV is actually a better predictor of outcome than anything that a Pap smear is going to show us. And so really, identification of HPV subtypes has sort of revolutionized our approach to treatment. In terms of next-gen sequencing, at this point, we are not there yet. I expect.
So can I ask you, because this is a fascinating question, but I don't know if everybody is familiar with this next-generation sequencing. Could you tell us a little what is the meaning of last generation and next generation sequencing?
So next-gen sequencing is really sequencing of the DNA of the cell to really establish which cells potentially have either a pre-malignant potential or the potential to become a more invasive cancer. So at this point, I'm not aware of any technology that allows us to do that in a large population screening way. I expect that you're right in that I'm sure there are companies that are actively working on that. I just don't know of any.
Which will be more towards the personalized medicine in terms of what the specific, but that brings us to another question that is here. Is there a genetic component to cervical cancer?
Yeah, that's a great question. And actually we hear that frequently. And so at this point, there is not a known genetic component to cervical cancer. We will hear a lot of sort of that patients' family members have had a lot of cancer, and so cervical cancer was sort of the next cancer to happen, and that it was genetic. But there's no data at this point to say that cervical cancer is a hereditary cancer.
Yeah. So this is another example of a type of cancer that is not transmitted by generations. We cannot blame our parents to give us a gene that. This is really an environmental cancer. And I think we have another examples like gastric cancer, or liver cancer and so on, who are really the result of an inflammatory process or the chronic inflammation that is happening due to viral infections. What stage is the majority of cervical cancer diagnosed?
Yeah, so luckily for us, the majority of cervical cancer is really in an early stage and really is treatable and curable with either just surgery or chemotherapy and radiation. And really, the goal and all our goals as GYN oncologists and as physicians is really to see that there is no woman or man anywhere, either in the US or in the world, that dies of an HPV-associated malignancy. That is the ultimate goal.
And I think cervical cancer is another example because it was one of the killers many years ago. I mean, the number of women who were dying of cervical cancer was incredible. So and that curve changed when the Pap smear came in.
So if you look at, gynecologic cancers in the United States and in the world, cervical cancer is the most common cause of gynecologic cancer deaths in the world, not so much in the United States. And that really goes to hopefully, screening, prevention, treatment opportunities that we have here that perhaps third world countries or other places do not have. So we have come a long way. We're just not there yet.
Yeah. And then again, is the emphasis for all of us how important it is to work on prevention and early detection for all the different cancers. We have a comment here. If I can help with EPI-type questions, a great starting point is, and there is a link in the website. Thank you for that information. If anybody there, you can look in the chat. There is some statistics, I think, about cancer and so on. I don't think I can open that, but everybody can.
So to that same point, there are a number of websites that we would recommend that if you are interested, curious, have questions about that perhaps we didn't answer or I didn't answer in enough detail. The American Cancer Society has a great website on cervical cancer prevention, treatment, stages, as well as the Centers for Disease Control. So they will tell you sort of the vaccination, you can, to the level of vaccination rates in your city, in your county, in your state, compared to the population, cancer death rates in your state versus the population as well. So really great websites to get this information.
I have received some questions of women asking, if I vaccinate my daughter at the age of 9, how I know that she's not going to become infertile and that she may not never have a child. And they are afraid of vaccinating their daughters at such an age. What would you recommend?
So, the data, so HPV vaccine has been around for a long time. Like we said, it's been around for at least 15 years. So we have a lot of data on its safety and its efficacy. And there is no data that says that vaccinating your child will increase the risk of infertility. The other common misconception is also that, vaccinating your child will increase sexual promiscuity or that they're more likely to be sexually active. And really, again, there is no data that says that vaccinating your child will increase their risk of having sexual activity or having more frequent sexual partners. There is just no data. So what we recommend is that at the same time that your child is getting their standard vaccinations, whether that's at 12, 14, that you include the HPV vaccine as part of that vaccination set. The vaccine, which we may be getting to, really depending on the age, can be either 2 doses or 3 doses. And so really should be very easy to add that to the vaccines that they're already getting.
So going out to the cancer again, just to start wrapping up as we are getting almost at the 45 minutes. What is the rate of progression of cervical cancer? So if a patient is diagnosed with stage 1, or he has a stage 1, and has not been identified, is she going to die at 6 months and 2 years? What can you answer to that question? So
the progression of what we know about cervical cancer is that the progression from a normal cervical cell, one that becomes infected with HPV, to a cervical cancer can be anywhere between 6 to 10 years. So it's a very long time.
And it's a silent time, unfortunately. Yeah?
Correct. But it's not so silent if you are getting your screening, right?
Yeah.
So
exactly.
it suggests that there is really an opportunity there to catch cervical cancer before it ever becomes a cancer, and to treat it before it ever becomes a cancer.
It's very important, yeah. So the disease is telling us, I am here, but we need to have our ears open and look at it. Do you find that most men know that they can contract HPV, or it's mainly associated with women?
Yeah, that's a great question. Unfortunately, HPV has sort of become a disease burden for women.
Yeah.
And I think that part of our discussion today really suggests that it's important that we understand that HPV is a disease that affects both men and women, and that men be cognizant of that boys get vaccinated against HPV, just like girls should get vaccinated against HPV, and that really it's a shared burden, right? It's a shared societal burden that we treat HPV-related diseases.
Thank you. I think this is very good point because I still remember when teaching even to medical students about sexual transmitted disease, and when we touch HPV, immediately was, oh no, that's a problem of the woman. And I think Dr. Gogo is putting us very clear. This is a disease of the partners, of the couple, and prevention has to go for both. So should the boys be immunized?
Absolutely, 100%. Boys and girls, the recommendations are starting from the age of 9 to 45 can be vaccinated. So again, if you have boys, if you have girls, the discussion should be with your pediatrician to have them both vaccinated as part of their standard vaccination series.
I hope that is, we have another question. What preventive measures can a patient take if they have contracted a high-risk strain, a viral strain, I suppose, alongside regular PAPs and colposcopy?
Yeah, that's also a great question. So really, HPV virus infection for the most part is self-limited. And generally your immune system will fight off the HPV just like it fights off another. So anything that keeps your immune system healthy, so no smoking. So if you're a smoker, to stop smoking. Again, prevention, going to your gynecologist at the routine time for the regular visits with the appropriate treatments. There is some data about really smoking, taking good care of yourself, sleep, moderating your stress. I mean, none of that is going to be able to be tested.
The stress, moderate stress, somebody can have moderate stress at this time.
Right, absolutely. So, anything that
exercise
maintains your immune system, exactly. Maintains your immune system is what will help you fight your HPV infection, along with.
And you are right, because it's known, especially in adults, that when they are immune suppressed, HPV appears, especially also in men. We know that men who have immune suppressed or a very strong elderly people where the immune system is suppressed, one characteristic is that they start having HPV.
So patients that are that have gotten transplants that are on immune suppressive medications, patients that have infections with HIV are all at higher risk of developing cervical dysplasia or cervical cancer.
So taking care, prevention, strengthen the immune system. And if there is any signs, go early and detect it early. So we're getting the picture there. Yeah?
Absolutely.
We're getting the picture. And adding to that picture, there is a very interesting question from one in the audience. Can you speak to the link between cervical cell dysplasia and vitamin D deficiency?
So, there is not a clear relationship as far as I know. There is some data in the literature that suggests that vitamin B supplementation may help in terms of maintaining a good immune response and potentially decreasing your risk of HPV infection. I don't know that that's ever been studied particularly, but certainly anything that maintains a healthy immune system, whether that's vitamin B supplementation or not, is important in terms of just generally good health and taking good care of your cervix.
Fantastic. I don't know if there is an additional questions from the public. If you still, we have a few minutes now for questions from the public directly. If you want to open your microphone. We have still another question here. Are there different cervical cancer screening protocols for people with HIV? Oh.
Yeah, so that's a great question. So the ASCCP, which is our clinical society for colposcopy, has very specific algorithms for patients. At this point, the screening is the same, but there is a little bit more of an intense treatment algorithm for patients with HIV compared to patients that are not immune compromised.
Is that clear? Good. Any other aspect of this? I don't know. I cannot see one of the questions. Alisa, you can go down. there is still, we have another 5 minutes, you okay? Just to open for questions. I think we have covered the majority, the subjects that we had. We talk about the risk of the vaccine. I don't know if there is anything else there. Okay, so again, I hope if we can wrap it up. The message that we have is that the health of the cervix is not a task only for the woman. It's a task of the couple, if they are a couple. And that prevention starts in early age. If you want to protect your daughter, because we always think that our daughters are the purest and nicest in the world, but we have to accept the reality that we don't know who they will be their friends. So if you want to protect your daughters, even they are the holies of the holies, maybe their future husband will not be the one, vaccinate your daughters. And if you protect also your daughters, vaccinate your son. Go to your doctor for a regular checkup, and if there is a sign, don't start trying to fix it with strange things. Have an exam, have your pap smear, your PCR. I know this is the genetic way to check for the presence of the virus, because early detection saves lives. Dr. Gogol, I want to thank you for the fantastic explanation. I think all the public here has been able to understand. If there are questions, where can we find you?
So absolutely, again, thank you very much for letting me be here today. It is a topic that's near and dear to my heart, and I'm sure on my partners as well. And so, yes, if there are any questions, you can find us at the Gynecologic Oncology Clinic at Carmanos Cancer Institute or Wayne State. I'm happy to provide my name, contact information, and an email address should there be any further questions. But again, as you said, the most important thing is prevention, and that's really the message that we're here to spread.
Fantastic. So again, if you need additional information about Dr. Gogoy and where have to find you, you can write us and we will be happy to share that information. So before we conclude, I want to let you know that next month we are going to have a fascinating subject that I'm sure many of you are looking forward to hear, and that is, should pregnant women be vaccinated? We are confronting this COVID-19 pandemic. More and more pregnant women are showing serious complications. Should be vaccinated, should be protected with the vaccine. And the expert next month to answer the questions is Dr. Bernard Donick, MD. He is a member of Wayne State University and an expert, a world expert in the area of vaccination during pregnancy. So I'm looking forward to having Dr. Donick next month on March 11th. So mark your calendars. March 11th at 6 p.m. Should pregnant women be vaccinated with Dr. Donick? And with that, we conclude, and I'm looking forward to see you next month. Thank you very much.